Dr. Amber Belt, and today I'd like to talk to you for just a few minutes about fever. Culturally, fever is something that we're conditioned to suppress the instant that it happens. And yes, very high fevers do have some dangers, but those high fevers are pretty rare. A mild fever, such as the fever that most of us will get during the course of an illness, has important impacts on our immune response when an infection does occur. So, here are some fun fever facts. Overall, in observational human studies and in animal studies, fever actually enhances infection survival. Fever also discourages the replication of pathogens. Virus, bacteria, and other pathogens are really comfortable replicating at our normal body temperature. When our temperature rises and we have a fever, pathogens become uncomfortable and cannot replicate as quickly. Fever causes us to produce a very important white blood cell called CD8 cytotoxic lymphocytes. This particular cell destroys tumor cells as well as cells that have been infected by a virus. And that seems pretty important, right? Fever induces heat shock protein 90, which, to keep things really simplified, is just one of the elements that help our white blood cells migrate to the area of an infection or to a lymph node, whatever the case may be. So this migration helps your body deal with either a localized infection or a systemic infection. So yeah, I mean, a fever is uncomfortable, but it's worth it for the immune bump that we do get from it. This bump helps our immune system become even more effective at combating an infection when we do get sick. And honestly, given how driven we all are to get back to work and be productive after or even during a time of illness, the discomfort of fever discourages us from jumping back into our normal routine too soon before our body's ready. And keep in mind that suppressing a fever is only going to prolong illness and slow recovery. This is something I've seen over and over again in my years of practice in both children and in adults. One question I'd like to answer that you might have is, when is a fever too high? In general, this is not medical advice, but in general, if a fever reaches 102 or 103 degrees Fahrenheit, it's advisable that you call your doctor. If an adult patient of mine has a temperature that's that high, I would advise them on natural ways to bring that fever down a bit, but I would not strive to get my patient's temperature back down to normal. I still want for my patient the immune benefits of fever, but your course of action needs to be between you and your doctor, just like any other medical decision should be. All right, I hope that this video helped you learn a little bit about fever that helps you be more tolerant of this uncomfortable immune response next time it happens. All right, have a great day. Bye.